Today my topic is cigarette smoking, and why I choose this topic is because none of my family members smokes, but most of my friends and those who are my Shia brothers and sisters, they start smoking at early age. So I just want to tell them about the hazards of smoking. Tobacco use, particularly cigarette smoking, is the single most preventable cause of death in the United States. Cigarette smoking alone is directly responsible for approximately 30% of all cancer deaths annually in the United States. Smoking during pregnancy can cause stillbirths, low birth weights, sudden infant death syndrome, also called as SIDS, and other serious pregnancy complications. Quitting smoking greatly reduces a person's risk of developing the disease mentioned and can limit adverse health effects on the developing child. This is basically the picture of the lung cancer, and as you can see, it shows the solid lung with the abscess, and the lung has been solidified. It does not have the capacity to expand and contract. Cigarette smoking also causes chronic lung diseases like emphysema, chronic bronchitis, cardiovascular diseases, stroke, and cataract. What are the effects of cigarette smoking on cancer? Cancer rates. Cigarette smoking causes 87% of lung cancer deaths. Lung cancer is the leading cause of cancer death in both men and women. Smoking is also responsible for most cancers of the larynx, which is basically the voice box, oral cavity, pharynx. Pharynx is the passage of the airways, esophagus, which is also called as the food tube, and the bladder. In addition, it is a cause of kidney, pancreatic, cervical, and stomach cancers, as well as acute myeloid leukemia. Myeloid leukemia is basically the cancer of blood cells and the bone marrow. This is the picture which shows the normal lung, which is very fluffy and pink, and it is showing the emphysema, basically caused by the smoking and the lung cancer. Emphysema is when the elasticity of the lung has been like being gone, or it is being there is no elasticity of the lung, and the recoil of the lung is there is no recoil of the lung, and so when the air is there, it is not there won't be any transfusion of gases. And the lung cancer is like the solidification. You can see there is no the lung has no fluffy expansion and contraction capacity. What harmful effects chemicals are found in cigarette smoke? Cigarette smoke contains about 4,000 chemical agents, including over 60 carcinogens. In addition, many of these substances, such as carbon monoxide, tar, arsenic, and lead, are poisonous and toxic to the human body. Nicotine is a drug that is naturally present in the tobacco plant and is primarily responsible for a person's addiction to tobacco products, including cigarettes. Nicotine is like acting as a neurotransmitter, and it acts on the brain receptors. During smoking, nicotine is absorbed quickly into the bloodstream and travels to the brain in a matter of seconds. Nicotine causes addiction to cigarettes and other tobacco products that is similar to addiction like heroin and cocaine. The lung, which causes the cigarette smoking that causes the lung cancer, it is basically called as old cell carcinoma or small cell carcinoma, or there is non-small cell carcinoma. Small cell carcinoma is categorized as into two stages: limited stage and extensive stage. Limited stage means that the cancer is only limited into one lung or its lymph nodes on the same side of the chest, while the the extensive means that it has spread to either to the opposite side of the chest or to the distant organs. The CTCA suggests that the treatment is radiation and chemotherapy. Non-small cell carcinoma of the lung, it is basically using Roman numericals through 0 through 4. 0 is the lowest number, and the 4th is the highest and the most advanced stage, and the CTCA suggests surgery. Lung cancer is the deadliest type of cancer for both men and women. Each year, more people die of lung cancer than breast, colon and prostate cancers combined. Lung cancer is more common in older adults. It is rare in people under age 45. Cigarette smoking is the leading cause of lung cancer. Cigarette smoking is the leading cause of lung cancer. The more cigarettes you smoke per day and the earlier you start smoking, remember, earlier you started smoking at an earlier age, the greater your risk of lung cancer. There is no evidence that smoking low-tar cigarettes lower risk. However, lung cancer has occurred in people who do not smoke. Smoking and other tobacco use are associated with 70 to 80% of oral cancer cases. Smoke and heat from cigarettes, cigars, pipes irritate the mucous membrane of the mouth. Use of chewing tobacco, snuffs causes irritation from direct contact with the mucus. This is the picture of oral ulcers in an 80-year-old person who smokes. This is a picture of the cancer of uvula. 57-year-old person who smokes 75 packs of cigarettes per year. She also has the cancer spreads into nasopharynx. COPD is like chronic obstructive pulmonary disease. It has 4 diseases, including chronic bronchitis and emphysema. Chronic bronchitis is the cause of asthma, leading cause by chronic smokers. Chronic bronchitis means your airways are irritated, narrowed, and make too much sticky mucus. The walls of your airways are swollen and block air from passing through. This overproduction of mucus leads to coughing, the sputum production, and by blocking your airways, like in asthma. With emphysema, the walls of the air sacs in your lungs lose their elasticity and air gets trapped inside. Bladder cancer, transitional cell carcinoma in the United States. Bladder cancer usually starts from the cells lining the bladder, transitional cells. These are of 2 types, papillary tumors. They are wart-like projections and they can be treated by surgery. Non-papillary tumors are much less common but they are much more invasive and worse. As with the most other cancers, the exact cause of bladder cancer is uncertain. However, several factors may contribute. The number 1 factor, cigarette smoking. Smoking increases the risk. As many as 50% of all bladder cancers in men and 30% in women may be caused by cigarette smokes. It increases the cancer by 5-fold. Now, how to quit smoking? There are a lot of ways to quit smoking and many resources to help you. Family members, friends, co-workers may be supportive or encouraging, but the desire and commitment to quit must be on your own. Most people who have been able to successfully quit smoking made at least one unsuccessful attempt in the past. Try not to view more past attempts to quit as failures, but rather as learning experiences. Identify the times you are most likely to smoke. For example, do you tend to smoke when feeling stressed, when you are out at night with friends, while you are drinking, when you are bored, while you are driving? Keep a diary to help you determine such risky times. Record each time you have a cigarette, including time of day and what you are doing. Make a plan about what you will do instead of smoking. Now try to quit smoking in this blessed month of Ramadan. It would be you and your determination. Mark it down how determined you are. After all, you and we are all followers of Imam Ali alayhi salam. In this blessed month of Ramadan, count your number of cigarettes. If you have 15 cigarettes per day after iftari, make it 14 for at least 3 to 4 days and then cut it down to 12 for 3 to 4 days and then cut it down to 10 and then 9 and then 8, and then when you reach 5 cigarettes, hopefully with a big smile, then after 3 to 4 days cut it down to 4.5. Have the courage to throw half of your valuable drug and your money. That's how only you can quit. Slowly cut it down. Do not force or push your body beyond your limits. Slowly cut down so your body will never know what's going on and it will adapt and adjust with the changes. If you push and cut down hard, then most probably your body bounces back and you start smoking again. So don't do that. Best of luck.